Hi, everybody. We'll go ahead and get started now. Welcome to this afternoon's webinar. I am Chris Kane, CPWR's Executive Director, and I wanted to welcome you to today's webinar. It's the CPWR NIOSH COVID-19 webinar series. We've done over 20 of these since the beginning of the pandemic, but today is COVID 101, back to the basics. So we've been doing these webinars in partnership with NIOSH, and we're trying to share relevant information, timely information, and especially with the Omicron variant booming right now, we thought it was time to kind of go back to the basics and how do you control for COVID exposures on construction work sites. Today, we're going to hear from Dr. Doug Trout, Medical Officer of the Office of Construction Safety and Health at the National Institute for Occupational Safety and Health. Dr. Trout will discuss a layered approach to controlling COVID at work and will be available to answer questions following his prepared remarks. Thanks everybody for joining us, and Doug, thank you very much for presenting today. And so it's on you. Thanks.
Great, thanks Chris, and thanks to CPWR for sponsoring these webinar series. I hope to spend the next 25 minutes or so reviewing some of the basics related to COVID-19. And along the way, I will address some of the questions that we received ahead of time in the registration. And then I know we have some more questions that we hopefully will have time to address at the end. But keeping up to date on COVID-19 information can be challenging, as we know. And so on the slides, I have included a number of websites that have been recently updated. And this presentation will be available either on the CPWR website, or you could probably email us to get a PDF. So I've included the links. There's a lot of links in here. And unfortunately, because the topics change so quickly, it really is important to stay up to date with current information by going to the current websites. So that's the way we'll handle that's why I put all the links in the slides. So this is the outline I'll be following. I'm focusing on the principles, as Chris mentioned, I'm focusing on the principles of the layered approach to COVID-19 prevention. And I'll be doing that from two perspectives: what we should be thinking about personally and individually, and also the same concept of layers of prevention against the SARS-CoV-2 virus in the workplace, and specifically in construction workplaces. In between those two topics, I'll review some of the updated guidance that you may have heard about over the last several weeks from the CDC that I just mentioned. So it's hard to believe, but we are entering the third year of living with SARS-CoV-2, and there are different definitions of this word endemic, which you may have heard of. But whatever definition you use, I think the concept is important and gets to this layered approach. The SARS-CoV-2 virus does seem to be having a constant presence in our world right now. And my primary goal today, as I mentioned, is to review the multiple layers of protection against the virus, which we all need to keep in mind as we continually adjust in our work and our personal lives. So we've all seen different versions of this picture, which shows the layers of prevention. And I think it actually is a very effective visual showing the types of prevention strategies that we have. And this slide also reinforces the idea that we can likely have successful prevention, even if there may be some situations where any one of these specific individual controls is hard to put into practice. So starting from an individual point of view, as I've mentioned, one of the important CDC web pages is this one, titled How to Protect Yourself and Others. And here is a list of the layers of prevention that the website provides details on. The first is to get vaccinated. The available vaccines can help protect us from COVID-19. The widely available vaccines are, for most people, one of the cornerstones of prevention. And I'll mention some more about vaccines in a few minutes. The CDC guidance recommends use of masks as preventive measures. I have an asterisk by this mask bullet because one of the questions we received early on in advance to as we were preparing for the webinar was about masks. And the question specifically had to do with whether KN95s would be acceptable as higher levels of respirator in a certain city. And that's a very timely question. So on this CDC webpage, with the links at this, with a link to the webpage at the first bullet, the webpage describes different types of masks and respirators used to protect yourself and others from getting and spreading COVID-19. The page notes that masks are designed to contain respiratory droplets and particles. Masks also provide some protection from particles expelled by others. The masks we use should have a proper fit over the nose and mouth to prevent leaks, and a nose wire is recommended to help with that type of fit. And the mask should contain multiple layers of material. Respirators, which are different from masks, are designed to protect us from particles, including the virus that causes COVID-19. And in doing so, they contain our respiratory droplets and particles so that we don't expose others. So the use of respirators is what I would refer to as respiratory protection. If respiratory protection is needed in the workplace, workers should be using respirators approved by NIOSH. NIOSH is the federal agency responsible for testing and improving respirators used in U.S. workplace settings. When an employer determines that respiratory protection is necessary in a workplace, OSHA requires the use of NIOSH-approved respirators. Workplaces covered under OSHA must also establish complete respiratory protection programs, which include components such as fit testing, training, and medical evaluation. And the second bullet at the bottom of this slide provides a link with information about respirators. So KN95s, which our question was about, are devices which are produced to meet an international standard. And the question that was posed to us was about local acceptance of the use of KN95s. Right now, whether any particular mask is accepted by a specific city or local jurisdiction for use related to COVID-19 really is a jurisdiction by jurisdiction issue. But one of my main points here is that this issue should not be confused with the issue of respiratory protection provided by NIOSH certified respirators. And I also want to note, just as kind of a footnote, but potentially important, is that in the past, NIOSH has found that a certain percentage of KN95 circulating in various communities have been found to be actually quote unquote counterfeit, or not actually the KN95s they were purported to be. So the type of you have to be cognizant of those types of issues when you think you may be getting one type of device and you may not be. So getting back to our list of prevention measures, maintaining distancing and minimizing time spent in crowded or poorly ventilated spaces should decrease the risk of infection. The CDC recommends a number of ventilation-related interventions. And of course, from a personal perspective, sometimes specific ventilation interventions are beyond our control, or beyond our personal control. And they may be more appropriate when thinking about workplaces. And I will talk a little bit more about that towards the end of the talk. Testing and appropriate actions after receiving positive test results can be used to help diagnose infection and to minimize spread to others. We had a question about, we also had an early on question about best practices for testing, and that's also a really relevant question right now. So I've put an asterisk here, and I'll get back to that question in a couple minutes. Other basic infection control activities remain important, and I've listed them here, such as washing hands and appropriate respiratory hygiene practices. So all of these preventive measures are important to protect individuals from acquiring and transmitting the SARS-CoV-2 virus and should be done in conjunction with one another. For those who like mnemonics, the 4 Ds of maintaining distance, decreasing density of potentially infected people, increasing ventilation to achieve dilution of potentially infectious air, and decreasing potential exposure duration are another way to think about the layers of preventive measures important to minimize exposure to the SARS-CoV-2 virus. So in the next few slides, I'm going to review some of the updated guidance from the CDC over the last several weeks. As of a week or so ago, the CDC updated guidance to recommend that all people stay up to date with COVID-19 vaccination. Based on what we know about COVID-19 vaccines, and similar to what we know from other recommended vaccines, people who are up to date with their vaccines are well protected from serious illness or other health outcomes. At this website, in the third bullet, COVID-19 vaccine booster shots, the CDC provides a table which lays out all the different booster possibilities. And I encourage you to go to that website. The details are a little bit more than I have time to get into today. But with an increased immune response from a booster, people should have improved protection against COVID-19. The topic of breakthrough infections is discussed at this CDC webpage with the link at the bottom bullet, in the bottom bullet I have in the slide, and this was updated in mid-December. This website points out that vaccines are not 100% effective at preventing infection. Some people who are fully vaccinated will still get COVID-19, and an infection in a vaccinated person is referred to as a vaccine breakthrough infection. This is one reason why the layers of preventive actions that we are talking about today and which are present in the current guidance are so important. So as I had mentioned, we had a question, one of our earlier questions that we received prepping for the webinar was about best practices for testing employees in the field. And this is a really relevant question now. There are several ways to address that type of question. The first is that testing best practices will in part be governed by local situation. For example, what are the capabilities of your workplace? What are the capabilities of your health department, your local medical providers, and even the local supply of home tests, because self-testing is becoming a more and more important consideration. The two websites that I noted on the top of this slide include guidance about testing for current infection and the specific topic of self-testing. Some of the key points, which I've included just in the bottom bullets, are that these websites provide criteria for who should get tested and who does not need to be tested, and also what are the things to think about after getting a test result. Another part of the approach to best practices for testing in the workplace another discussion and a lot of detail actually are provided on this webpage, which has been available on the CDC internet for quite a while now, and maybe I'm hearing it may be updated soon. Workplace-based testing for SARS-CoV-2 should identify workers with infection and thus help prevent or reduce further transmission in the workplace. The guidance available at this website provides employers with considerations for incorporating testing for SARS-CoV-2 into their workplace COVID-19 plan. This guidance includes descriptions of the different types of SARS-CoV-2 tests, scenarios where SARS-CoV testing may be used, and considerations for the use of testing as a diagnostic test versus use as a screening testing, including the use of antigen tests for serial screening testing. Oops. So Chris just told us and just has come across the news that the Osha vaccination testing emergency temporary standard, or ETS, has been stayed. My understanding is that the merits of the case still need to be adjudicated, or for lack of a better word. So I don't have any inside information, as Chris mentioned, on that, but I think we should be aware that in terms of testing best practices, that OSHA vaccination and testing ETS would require covered employers to ensure that each employee who is not fully vaccinated to be tested for COVID-19 at least weekly. And that's what the ETS said. So that's for persons who are in the workplace at least once a week, or tested within 7 days before returning to work if the person were away from the workplace for a week longer. The OSHA vaccination testing ETS also includes more detail about that. And also there's a section in the ETS on employee notification to employers of a positive COVID-19 tests and actions that need to be taken after those notifications. So other recent updates from the last couple of weeks, which I think you've probably heard about, I wanted to review briefly. Quarantine and isolation has been really important. Isolation refers to actions taken by people who have a positive viral test for COVID-19 and by people with symptoms of COVID-19. And the recommendations for isolation are the same for all, regardless of the vaccination status. The recommendation is to isolate for 5 days after testing positive or developing symptoms. After the 5 days, the isolation can end as long as the symptoms have improved and there's no fever. And the guidance also includes continuing to wear a mask around others for another 5 days after the isolation has stopped. Regarding testing, if an individual has access to a test and wants to test during isolation, the best approach is to use an antigen test towards the end of that 5-day isolation period. The quarantine recommendations apply to persons who have been in close contact with someone with COVID-19. The quarantine recommendations differ depending on vaccination status. For adults who are up to date on their vaccines, and for persons who tested positive for COVID-19 in the last 90 days, the recommendation is to wear a mask when around others for 10 days, and also to get tested at least 5 days after the exposure. For all others, including persons who had the primary vaccinations but not the recommended boosters, the guidance is to stay home or quarantine for 5 days, wear a mask around others for the full 10 days, and also to get tested at least 5 days after the exposure. Now I'm going to switch gears back to our main idea for today of the importance of the multiple layers of prevention. But for the next few slides, we'll take the workplace perspective. So CDC recommends workplaces implement layered prevention strategies, which include vaccination and other measures such as ventilation, testing, hand hygiene, and mask use that I've mentioned above. Throughout the pandemic, we have been working with other federal partners to share the science and guide decision-making, and in particular with OSHA in creating prevention guidance. This is a link and a screenshot of a current CDC guidance page related to the workplace, and you will see on this page and others that the CDC websites refer the user to the OSHA site, like you see here in the circle. For the next few minutes, I'd like to summarize an outline of the OSHA guidelines. This is the link to the main OSHA COVID site and a screenshot of the 3 categories of information OSHA provides on their site. So on the left, you see the information about the emergency temporary standards. I'm not going to say much more about those. I am going to briefly summarize the OSHA guidance that you see circled, and that's been present up there for a number of months. And on the right, there's another section with really good information that's called Highlights and Tools, and they have other great workplace information there, but I'm not going to get into that today. So the OSHA guidance on mitigating and preventing the spread of COVID-19 in the workplace is based on the responsibility of employers to provide a safe and healthy workplace free from recognized hazards likely to cause death or serious physical harm. The OSHA guidance provides an outline of how employers should engage with workers and their representatives in implementing a multi-layered workplace program to mitigate the spread of COVID-19. This is the link to the actual guidance that you can find on the internet. So I have one bullet for each of the 11 categories within the OSHA guidance in the next couple slides. And in some cases, I've inserted some links to relevant CDC guidance. The first is guidance that employers should facilitate employees getting vaccinated. This includes, for example, by allowing paid time for employees to get vaccinated and recover from any side effects. I've included here links to 2 CDC websites. The first provides information on workplace vaccination programs, and the second is a new site that provides examples of successful worker COVID-19 vaccination programs. Right now, at this second site that I mentioned, there are 5 short case examples from agricultural and food processing work sites. Employers should provide clear instructions for workers on how to follow appropriate isolation and quarantine guidance, and to ensure that absence policies are non-punitive. For example, this latter point should include eliminating or revising policies that inadvertently encourage workers to come to work sick or after an exposure. And the third and fourth bullets cover guidance related to physical distancing and the use of masks. The next several components of the workplace COVID-19 guidance from OSHA are listed here and include education and training of workers on basic facts about COVID-19 and the workplace COVID-19 policies and procedures using accessible formats and in languages that can be understood. This includes training managers on how to implement COVID-19 policies. Guidance related to the use of masks for customers, visitors, or guests is part of the OSHA guidance, as is routine cleaning and disinfection that I have in the fourth bullet. I have an asterisk on the maintenance of ventilation systems as a topic particularly important for the construction industry and particularly in the colder months that we're in now. This topic includes proper use of existing ventilation improvements when needed, and also includes things like the use of portable air cleaners. And I'm going to come back to ventilation in one or two more slides. So the last of the 11 components of the workplace plan outlined in the OSHA guidance are listed here, and they include recording and reporting COVID-19 infections and deaths and having a plan for workers to voice concerns about COVID-19, which includes protections from potential retaliation related to voicing those concerns. So getting back to ventilation for a minute, ventilation is an important part of the layered approach recommended by OSHA and the CDC to reduce exposure to SARS-CoV-2. Ventilation mitigation strategies can help reduce viral particle concentrations, so it's less likely that viral particles can be inhaled into the lungs or contact eyes, nose, and mouth. And even within the topic of ventilation, there are a range of ventilation interventions that can be helpful. Implementing multiple tools related to ventilation at the same time as feasible is consistent with our layered approach to prevention and will increase overall effectiveness of ventilation interventions. The CDC site I've listed at this first bullet includes a list of tools that might be applied to different building types, occupancies, and activities under changing environmental and seasonal conditions. For example, among the tools listed for work areas which may not have full functioning HVAC systems are to use portable air cleaners. Portable HEPA filtration units that combine a HEPA filter with a powered fan system are a preferred option for auxiliary air cleaning. These types of systems do not bring in outdoor dilution air, but they can be effective at cleaning air within spaces to reduce the concentration of airborne particulates. The CDC site also provides discussion of other topics, for example, use of fans, particularly in combination with open windows, details about the use of barriers, and also discusses the topic of directional airflow. The CPWR has great resources which can provide really practical guidance concerning ventilation for construction workplaces. The first link I have listed is a document providing quick tips to increase ventilation at indoor construction sites without operating HVAC systems. And the second document is a report of a survey done to collect information on ventilation challenges facing the construction industry and steps being taken or planned to increase ventilation in enclosed work areas on job sites. Among the information in this second report are lots of examples of specific situations faced in construction workplaces and interventions that were tried. And so many of those may be of interest to you. And this is just a screenshot of the CPWR quick tips document I just mentioned. So just to finish up, this is my last slide. I hope my overview today has been helpful. And I know I have relied quite a bit on providing links, but the reality is that as we've seen even today, changes in the pandemic week to week and month to month require that we do our best to stay up to date with the changing information. And that's one of the big challenges we all have been facing throughout the pandemic. So on this page, I've just provided some of the main resource pages for OSHA first, and the CDC second, and the CPWR, including their construction clearinghouse third. So that's the end of my prepared talk. I know we do, hopefully we will have some time to go through some of the questions.
Great, thank you, Doug. We do have a number of questions, as I mentioned earlier, that were sent in prior to the webinar. We also have a few questions that have come in over the Q&A and possibly through the chat, so I'll try to stay on top of that. One of the benefits of getting the questions that folks have before the webinar is that Doug was able to tailor some of his materials to try to answer those. And the first question that's on my list, you know, the person asks, you know, the riskiest exposures in construction are working in tight, unventilated spaces, job trailers, breaks, lunch times, lining up at lunch trucks, clustering around porta-johns or washing stations. And I think, Doug, you covered that. I mean, we
Yeah,
still have to think about physical distancing, right?
yeah, I would say this is a great question, and this is something we've been stressing really from day one, all the way back, you know, almost 2 years ago. And that's not to make light of the question. It's very difficult, but you know, really, this requires planning at each work site, and it requires thinking about. So, in terms of the unventilated spaces, I think we tried to cover that in some of the guidance that we have. But in terms of, you know, spacing out break times, lunch times, you know, making new space in trailers, or you know, somehow creating administrative controls so that everyone is not lining up at the same spot, clustering at the restroom areas or washing hands. Those are still real challenges, as you mentioned, Chris. And you know, basically, there's no magic answer to that other than advanced planning to spread those things out, have people take breaks at different times, have different egress points or entrance and egress points to workplaces and things like that.
Great. And you know, the other thing besides distancing, you mentioned ventilation in tight spaces. We have the document that we developed, that the links in the chat for buildings without operational HVAC systems, and that would include any type of tight space or a trailer or something like that. Then there's, you know, masking guidelines. CDC is recommending masking for people in all areas of high or substantial transmission still, and that's basically the United States of America right now. But some masks are not the same as others. So a lot of the questions that came in were about KN95s, N95s, cloth masks, and just, you know, thinking about the recommendations out of CDC. Do you want to kind of re-summarize that a little bit?
Yeah, the CDC at a very high level, the CDC recommendation is to still use masks, and I provided the web page that has some of the basic information on what makes an appropriate mask. It's really something that is tight, fits well, you know, and nose wire is really important, I think, for the fitting around part of the face. It should be double, you know, several layers of material, and you know, so that's still the basic information. And I even saw in the news today that, you know, this is a hot topic in the news, and I don't have any new information of what coming guidance may be, but I understand that the current mask guidance is still up there, and is what I've summarized.
Okay. And CPWR at the beginning of the pandemic did put out a set of quote unquote standards for expectations on job sites that included the physical distancing, as well as, you know, all the other stuff. But one of the things that we recommended in the beginning were the use of N95 or better masks, particularly where you can't physically distance from other workers. We know they work. There's no doubt about it, especially if they're well fitted, and they're done with a respirator program. But even when they're not mandatory, they're still recommended by CPWR, regardless of what the CDC says. And that's one area where we kind of diverge from our partner at NIOSH. We've always recommended a higher level of protection to protect yourselves as well as transmitting the virus. One of the questions that came in was current technologies related to contact tracing. I don't know if you had any recent information on that. I don't want to spring it on you.
Yeah, I don't have any new information. I know there have been, well, you know, I'll just back up. Contact tracing has been an emphasis and an important part of our response to the pandemic from day one. And I think it's been a challenge from day one. And I think the current scenario makes contact with, even more widespread transmission, that challenge of contact tracing continues. So I am not aware of any current technologies or new applications, for example, on phones or other types of applications that are being used to assist with contact tracing. It's still a at its base, it's a local health department function. And so some health departments may be more staffed, more able, staffed to a level that they're more able to perform contact tracing. And some health departments will not be as well staffed. So I think that is among the things that are, really jurisdiction by jurisdiction or health department by health department. Contact tracing is certainly one of them. The core function of contact tracing is a local health department function.
Right. So we had some questions about vaccinations as well. One question I think is really straightforward. Is it a HIPAA violation to verify someone's vaccination status?
Right. So the answer is no. That's the short answer. Workplaces are allowed to ask if someone is vaccinated, if a worker is vaccinated or not, but that information, if provided, it needs to be kept confidential. And the important thing is that the reasons behind being not vaccinated cannot be part of the discussion. So basically, it's okay to verify to ask about vaccination status, but not really to go further. And I would point, I didn't put this in my presentation, but for many of these, for lack of a better word, legal interpretations of HIPAA and other things like HIPAA or the ADA, the EEOC has the state-of-the-art information, and that's what CDC and others go to find what's correct. And so if you go to the EEOC COVID webpage, they have the answers to all these HIPAA questions and questions about ADA and things like that.
Thanks, Doug. One of the questions is, do some job sites require vaccination? Is there any guidance from CDC or others that recommends construction job sites require vaccinations?
There's not. Vaccination programs are recommended by CDC, but there's not guidance from CDC that job sites require vaccinations. However, we are aware that many job sites, workplaces, construction workplaces, and others have required vaccinations, but it's not part of the CDC guidance.
Right. And I know it was part of the federal contract rule that was issued by the administration in the fall. And I know federal contract construction employers who have required their employees to be vaccinated.
Right.
So I think that's it for some of the newer ones, are the old ones that came in that I understood fully. One question here, I don't know if we can answer it, but it's given the SCOTUS, or the Supreme Court of the United States has placed a block on the OSHA ETS on Vax or Test. Any chance OSHA could use the general duty clause instead? And I would postulate that the questioner probably knows the answer to this better than we do because she's a lawyer. But I think it's possible definitely for OSHA to use the general duty clause to enforce some things around COVID in construction. And the guidance that Dr. Trout walked through from OSHA is still in effect. It was in effect before the ETS vaccine test rule, and it's still out there from OSHA as guidance now. And as Doug mentioned, in that guidance document, it does point to some mandatory standards related to COVID. And I'm just scrolling down there. And the standards that are mandatory are, requirements around personal protective equipment, respiratory protection, sanitation, protection from bloodborne pathogens, employee access to medical and exposure records, and also record keeping. standards
record
do
keeping. We had a
apply.
question on record keeping. Yeah.
So while they weren't part of the vaccine test rule necessarily, they're still out there and they still do apply. There aren't really, a question came in about new reporting requirements. There really are not new reporting requirements. Those have been there in the record keeping rules. If the workers are hospitalized or die from COVID that they've gotten on the job. And we do know that there are some employers who do keep those records and are reporting it when they know that it was contracted on the job. I'm going to go to another area on my screen. The question was, did Doug cover the Supreme Court decision? No, we didn't cover it. I announced it at the beginning of the webinar that the Supreme Court has blocked the OSHA vaccine test rule. My understanding is they're sending it back to the Sixth Circuit Court of Appeals, and I don't know what's going to become of it. But right now, OSHA is blocked as of today, this afternoon, from enforcing the new vaccine test rule for employers of 100 or more.
So, Chris, I did notice, I want to point out, I think we said at the start that the pandemic is ever changing, and it's a challenge to keep up-to-date information, to get information out, communicated in a way that's understandable but accurate. So there is one question here on scientific basis behind allowing vaccinated and boosted workers to return to work. So that's the isolation and quarantine guidance that I briefly went over. So, but I will, for those who, if you really want to get into some of the scientific bases, I want to point out that the CDC has a website of scientific basis documents. So that's one place to look, and they're there because the CDC understands that the science is important to a lot of people, and they have explanations of the science behind many of the topics of the day up there. But there's also a webpage which it's called What We Know About Quarantine and Isolation, and it was updated January 4th. So if you want to learn about this question of allowing vaccinated and boosted workers to return to work, or in other words, follow the current isolation and quarantine guidance, go to this the site called What We Know About Quarantine and Isolation, and you'll see the rationale that the CDC is using to have updated the recent quarantine and isolation guidance.
And this question, I don't think you saw it, Doug. It came into me privately. There's somebody on the webinar's spouse's school district has established an incentive pay system this semester for attendance, and the person who wrote in suggests that this is incentivizing working sick after a COVID contact. Does OSHA or CDC, or we don't necessarily know of OSHA, but does CDC, from your perspective, Doug, offer any guidance or perspective on this?
I'm sorry, it was a plan to incentivize people to come back to work?
Incentivize people for attendance, and suggest the person who's asking suggested that it seems as though they're incentivizing working sick.
Yeah. I mean, I really just have to go back to the CDC guidance to follow the isolation if you test positive or if you have symptoms, and follow the quarantine guidance. That's the best, the CDC's best statement on that now in terms of this current science. And I can't really comment on that further, I think.
Yeah, I'll comment on it. Chris from CPWR is not a CDC employee, so this is happening all over the place. We've got a lot of people who are sick and who are being pushed to work while they're sick or after they've had an exposure. I know it's in all industries. It's in construction, but it's also in healthcare. I personally know people who are being discouraged from getting tested when they have symptoms in the healthcare industry, because obviously the hospitals are flooded and they're going to overflow very soon. and we need healthcare workers on the job is the perspective of the hospitals. Well, we do have healthcare workers working sick. We have them in all industries, and personally, I'm affected by it too. My kid's school is open, but their bus driver is unavailable. And I hope that our bus driver gets better, but that means that my husband and I are transporting our children to and from middle school. Or a friend today, so I could be on this webinar, was going to be picking them up. So really, this is impacting all of us, and the people who are out sick with COVID right now it is impacting pretty much every facet of our lives. And we hope that people are not working sick. That's my hope. But we know it's happening. I see that people are asking if the slide deck's available. We will be sending out a link to the slide deck with all of the links in it that Tyler/Jessica has been dropping in the chat during the webinar. And we will also be linking to a recording of this webinar if you wanted to share it or review anything that was said in it. And with that, I'm just going to check the Q&A one more time. It looks like there might be something new in there. I mean, this is a really specific question. Quarantine for close contacts for boosted or fully vaccinated, but not yet booster available. Test on day 5, but if they aren't able to test, they wear a face mask and do social distancing for 14 days. Are they allowed to return to work? It's really, there's a lot of variables in there, and I'm not sure that Doug can answer that specifically, but I think pointing back to the quarantine guidance from CDC is the best answer to that question.
I think so. Unfortunately, just to be able to get through this, I did summarize some of the points that are available on, which is why I provided all the links. Some of them are quite detailed, and there's lots of examples and most of the examples are covered in the guidance. So I would go there.
All right, great. I wanted to go ahead and wrap up. Thank you, Dr. Trout. Really appreciate you joining us and presenting on this webinar. Dr. Ernest is also on the line. Thanks, Scott. And stay tuned. We'll be sending information on this webinar out, and we'll continue the series as needed. So we really appreciate everybody participating today. I hope you have a great afternoon. Thanks, Doug.
Okay. Thank you. Thank you all.